The hepatic portal system includes veins from the stomach, the intestines, the spleen, the pancreas, all of which carry, well, not the pancreas, but all of which carry nutrient rich blood directly to the liver by way of the hepatic portal vein. Remember that portal systems, much like the hypophyseal portal system that we saw in the endocrine system, they are one-way communication connections between organs. Here, all the organs absorbing nutrients are connected to the liver by way of this hepatic portal vein. The liver processes and detoxifies the blood it receives. It'll metabolize some nutrients, usually fats, and the liver does do some storage of vitamins and minerals like iron. But the liver is one of the two main organs, including the kidney, that tries to break down harmful substances like toxins and medications. Yes, medications. Most medications that you take are considered toxin by your organs. The liver and the kidney, they try their best to clear out those toxins, but you keep taking them. This is one of the reasons why antibiotics like clindamycin, usually used in dental infections, has to be taken 3 times a day because your kidney does a really good job at cleaning that out. Once the blood in the liver is clean, once it's been gone over by those hepatocytes, which I discuss in detail in another mini lecture, the liver dumps the blood right into the vena cava, and it goes directly to the right atrium and is distributed to the lungs for oxygenation and then is distributed to the body. And as I said previously, yes, this is not a person with two left kidneys in this picture. The top kind of left kidney, the top one, that's the spleen. And the spleen, because it does recycling of red and white blood cells, it's also attached to this hepatic portal system. Ascites refers to the abnormal accumulation of fluid in the abdominal cavity, and it's often caused by cirrhosis, the scarring of the liver. Cirrhosis can develop due to chronic hepatitis, fatty liver disease, alcohol abuse, or other metabolic dysfunctions involving most often lipid metabolism. So the impaired circulation in the liver itself causes a backup and it increases pressure in that hepatic portal vein. And this is a condition known as portal hypertension. So, as all of the fluid is being absorbed from the digestive system, from the alimentary canal, it enters into that hepatic portal vein and it basically has nowhere to go. So it starts to leak through the digestive organs into that abdominal cavity. So ascites, it obviously results in swelling and discomfort, but as the fluid accumulates, it can press against the diaphragm, resulting in a difficulty of breathing. So, yes, we can tap and drain the fluid. However, any hole increases bacterial intrusion. Many times, trying to treat the underlying cause is the best thing here for ascites. Hepatitis is an inflammation of the liver caused by the hepatitis virus. There are different types of hepatitis viruses, A, B, C, D, E, with hepatitis B and C being particularly concerning due to their potential to lead to chronic liver failure. So, chronic hepatitis can cause long term damage to liver cells, those hepatocytes. And this can lead to scarring in the liver, which is called cirrhosis. Symptoms of hepatitis usually include fatigue, jaundice, abdominal pain, dark urine, and an early diagnosis and treatment can help with complications that can arise once scarring starts to occur. Different to hepatitis, but similar in its effect on scarring, is fatty liver disease. And this occurs when fat accumulates in those hepatocytes. This condition can develop due to excessive alcohol consumption, but that is not the only cause. Obesity, diabetes, dyslipidemia, hyperlipidemia, a whole bunch of things concerning the metabolism of fats can lead to fatty liver disease. Fatty liver disease it also has a very strong genetic component. So in early stages, neither of these cause like noticeable symptoms other than I feel dehydrated. But over time, that little amount of inflammation causes that scarring and cirrhosis. Non alcoholic fatty liver disease is often linked to a metabolic syndrome and then has implications for cardiovascular disease if left untreated.